Hello, I'm Dr. Richard, and welcome back. Let me ask you a simple question. When was the last time you really looked at your feet, not just slipped on your shoes and headed out the door, but actually stopped for a moment to check them? It might surprise you to learn that your feet can reveal important clues about your overall health, sometimes even before you notice other symptoms. If you've been experiencing tingling, numbness, burning, cold feet, or a small cut that just doesn't seem to heal, don't ignore it. These changes don't always mean something serious, but they are your body's way of asking for attention. Today, we're going to explore some of the subtle signs your feet may be giving you about your blood sugar and why recognizing them early could make a meaningful difference to your long-term health. So, grab a cup of coffee, get comfortable, and let's take a closer look at what your feet may have been trying to tell you all along. Have you ever taken off your shoes at the end of the day and noticed that your feet just don't feel the way they used to? Maybe they're tingling a little. Maybe they feel unusually cold, even on a warm afternoon. Or perhaps there's a small cut or blister that seems to be taking forever to heal. Most people assume these are simply signs of getting older. But what if your feet are trying to tell you something much more important? Your feet are remarkable messengers. Long before many people notice obvious symptoms of blood sugar problems, subtle changes can begin showing up where you least expect them, right at ground level. The surprising part is that these early warning signs are often painless, easy to overlook, and dismissed as nothing more than tired feet after a busy day. I've spoken with many older adults who later said the same thing. Looking back, the clues were there all along. I just didn't realize they meant anything. That's why paying attention matters. You don't need medical training to notice when something has changed. Sometimes it's as simple as realizing your socks leave deeper marks than they used to, your feet feel numb while watching television, or you're avoiding your evening walk because your feet just don't feel right anymore. These changes don't automatically mean your blood sugar is out of control. There are many possible causes, and only a healthcare professional can determine what's really going on. But they are important signals that deserve attention rather than being brushed aside. The encouraging news is that the earlier you recognize unusual changes, the more opportunities you have to work with your healthcare provider to understand what's happening and take positive steps for your health. Many people focus on blood sugar numbers from a lab test, yet forget to pay attention to the everyday messages their own body is quietly sending. And your feet happen to be one of the clearest places those messages can appear. Some of the signs we're about to explore are surprisingly common. In fact, you may have experienced one recently without giving it a second thought. The question is, what have your feet been trying to tell you? Think about your typical morning for a moment. You wake up, slide your feet into a pair of slippers, and head toward the kitchen to make your coffee. At first, everything feels normal, but then you notice something that wasn't there a few years ago. Maybe the floor feels strangely cold beneath your feet. Maybe your toes feel stiff for several minutes. Or perhaps there's a slight tingling sensation that disappears once you start moving around. It's easy to shrug these things off. After all, our bodies naturally change with age. But here's something many people don't realize. Your feet rely on a healthy network of tiny blood vessels and nerves. These delicate structures need a steady supply of oxygen and nutrients to work properly. When blood sugar stays higher than it should for long periods, those tiny vessels and nerves can gradually become damaged. The changes usually don't happen overnight. They tend to appear little by little, making them easy to ignore. One day, your feet feel slightly numb after sitting through your favorite television show. A few weeks later, you notice you're less steady walking down the driveway. Months pass, and you realize you can no longer tell if the bathwater is as warm as it used to feel. Because these changes happen so gradually, many people assume they're simply getting older. Sometimes they are, but sometimes they're your body's way of asking for attention. One of the earliest signs people often notice is a tingling or pins and needles feeling. It may come and go at first. Some describe it as tiny electric shocks. Others say it feels like they're wearing invisible socks or that their feet have fallen asleep even though they haven't been sitting in one position. That unusual sensation can happen for many reasons, including vitamin deficiencies, certain medications, circulation problems, or pressure on nerves. But persistently elevated blood sugar is also one possible cause, which is why it's worth mentioning to your healthcare provider instead of simply living with it. Another change that surprises many older adults is numbness. At first glance, numbness may not seem like a problem because nothing hurts. Ironically, that's exactly what makes it risky. Pain is one of your body's most valuable warning systems. If you step on something sharp or develop a blister from a new pair of shoes, pain usually tells you to stop and take a closer look. But when feeling is reduced, small injuries can go unnoticed for days. Imagine taking a walk through your neighborhood park, enjoying the fresh air, and returning home with a tiny pebble inside your shoe. Most people would notice almost immediately, but someone with reduced sensation might continue walking, allowing that pebble to rub against the skin for hours. A small irritation can gradually become a sore. That's why many diabetes specialists encourage people at higher risk to simply look at their feet every day. It sounds almost too simple, yet this small habit can help you notice cuts, redness, swelling, or blisters before they become bigger problems. Another clue often overlooked is slow healing. Perhaps you nick your toe while trimming your nails, or a small scrape from gardening lingers much longer than expected. Healing naturally becomes a little slower as we age, but persistently high blood sugar can make it even harder for the body to repair damaged tissue. It can also make it easier for infections to develop. Again, this doesn't automatically mean diabetes is the cause. Many conditions can affect healing. The important lesson is not to ignore wounds that aren't improving or seem to be getting worse. Those deserve prompt medical attention. There's another subtle change that catches many people off guard. Take a close look at the skin on your feet. Does it seem unusually dry? Are there cracks around your heels that never seem to go away despite using moisturizer? Is the skin becoming thinner or more fragile? While dry skin is common as we grow older, changes in sweat production and circulation can also contribute. Cracked skin isn't just uncomfortable. It can create tiny openings where bacteria can enter, increasing the chance of infection. Sometimes the smallest details tell the biggest story. Your feet don't suddenly wake up one morning and announce that something is wrong. Instead, they whisper through small changes that are easy to overlook during the busyness of everyday life. Learning to notice those whispers isn't about becoming anxious. It's about becoming aware. Awareness gives you the opportunity to ask questions, have meaningful conversations with your healthcare provider, and take simple steps that may help protect your long-term health. And often, those small daily habits make a bigger difference than most people expect. One of the biggest misconceptions about blood sugar is that you'll always know when it's high. Many people imagine dramatic symptoms, feeling extremely sick, intense thirst, or sudden weight loss. While those can happen, especially when blood sugar is very high, countless people live for years with elevated blood sugar without realizing it. During that time, the body quietly adapts, even as small changes begin affecting the nerves and blood vessels. Your feet are often among the first places where those changes become noticeable. Here's why. Here's the encouraging part. Your feet aren't just warning signs. You're also one of the best places to start taking positive action. You don't need expensive equipment, you don't need complicated routines, and you certainly don't need to overhaul your entire life overnight. Small, consistent habits often make the biggest difference over time. Let's start with something many people underestimate: walking. A simple daily walk can do more than burn calories. It helps your muscles use glucose more effectively, supports healthy circulation, strengthens your heart, and keeps the joints in your feet and ankles moving. The key isn't speed, it's consistency. Even a comfortable 20 to 30-minute walk around your neighborhood, a local park, or inside a shopping mall on hot or rainy days can become one of the healthiest parts of your routine. If you haven't been active for a while, begin where you are. Maybe that's just 5 or 10 minutes. That's perfectly okay. The goal isn't perfection, it's progress. Of course, if walking causes pain, dizziness, or other concerning symptoms, it's important to stop and discuss those symptoms with your healthcare provider before continuing. Another surprisingly powerful habit begins before you even put on your shoes. Take a moment to check them. Many people never think about the inside of their shoes. But imagine a small pebble, a folded insole, or a loose seam rubbing against the same spot for hours. If you have reduced feeling in your feet, you might not notice the irritation until a blister has already formed. That's why taking 10 seconds to shake out your shoes